Hello, everyone. Hi, Kayla.
Hi.
Hello, everyone in our Making Menopause Meaningful group. Let us know if you're watching live or if you are watching the replay below. There is a little private chat where we can see some of the comments that come in here, so we can be a little bit interactive with these things. Today is our Women of Wisdom, our Wow Wednesday, and today we are talking with Dr. Kayla Ruschkowski, who is a licensed naturopathic doctor in Kamloops. And she also has additional training and focus in women's hormone health, which is why we have her here today. And I'm super excited to hear from her. She has a presentation she's going to share with us. And I'm super excited to hear from her because I have seen the passion that she has in helping women. And I love the work that she's doing. So welcome, Kayla.
Thank you so much for having me.
You are so welcome.
Super excited to talk to all of you today. Let's see if we can get this presentation rolling here.
Is that good like that, or did you want the yourself to be bigger? Or I mean, the slide to be bigger. How's that?
I think that's good. Yeah, that's perfect.
And
just seeing if I can
all of it from there.
From my end. Yeah, so I can present it from my end as well. So yeah, I'm happy to get started now. So hi everybody, my name's Kayla, and today I'm going to be talking about naturopathic supports for menopause and perimenopause. I'm a naturopathic doctor here in Kamloops, and I work at a clinic called the Movement Mechanics. So let's get started. So the first thing I wanted to mention is that this webinar is for informational purposes only, and it can't constitute medical advice. So if you have any questions about your health, see your medical doctor or your naturopathic doctor. So I'll start with a little bit about me. So I'm from Regina, Saskatchewan, and I grew up playing sports. And from there, I developed an interest in fitness. And I believe that this in turn led to an interest in health and a passion for helping people feel their best. I loved school and learning, so originally I wanted to become a medical doctor until I read the naturopathic medicine principles, which I want to start off with today. The principles of naturopathic medicine are right here on the screen. So the first thing is do no harm. So it's really important to us that we start with the least invasive and the safest treatment options available. And secondly, we want to identify and treat the cause of symptoms rather than just treating the symptoms as well, because we know if we treat the cause, then oftentimes we can improve people's overall health as well. Next is to treat the whole person. So we know that people are very complex, individualized snowflakes, as we like to say.
Snowflakes.
So we want to really acknowledge that in naturopathic medicine. So not only do we have a physical body, but we have a lot of emotional health and spiritual health as well. And in naturopathic medicine, we also want to acknowledge that. And the next thing is the healing power of nature. So all around us, we can see it. Nature has the capability to thrive and to grow and to adapt, even under difficult circumstances. And the same goes for in our body. So even when we have difficult things, our body is made to heal. We know that when we, for example, cut our finger, our skin goes in and it heals. And there's so many other examples of that in the body. So in naturopathic medicine, we just want to acknowledge that, and we want to work with that. The next thing is the physician as the teacher. So that's one of the reasons why I'm so excited to be here today and share a little bit of information with you. So in naturopathic medicine, we do want to work as a team with our patients. And in order to be a really good team, it's important that we're both on the same page. So for example, it's important that we both know a little bit about what's going on, what our goals are, and also treatment options. So it's important that the physician also acts as a teacher. And then the next thing is prevention. So in naturopathic medicine, we not only want to help people feel better in the short term, but also the long term. And so that can involve helping prevent health problems in the future.
I love that this is what drew you into choosing this as a path. Those are really good core values.
Thank you. Yeah, I find it's really aligned with me as a person. So that's why I think I've been really happy in this field. So naturopathic doctors in BC are trained as primary care providers. So that means that we can be the first point of contact for a person's health concern. So we're trained to really recognize the limitations of our treatments and recognize our scope and refer when necessary. So you can always go to your ND with any health concerns that you have, and they're trained to treat them and refer when necessary. They're trained to treat the whole person and the underlying cause of symptoms. And they typically spend more time with their patients to provide individualized treatment recommendations. They can diagnose and treat disease, do physical exams, refer patients for lab work, and may prescribe pharmaceutical drugs if the ND has prescribing authority, like myself. We aim to work in collaboration with and not in opposition to other healthcare practitioners like your medical doctor, for example. And we primarily use diet and lifestyle recommendations, stress management, botanical medicine, nutraceuticals, acupuncture, and more. So today we'll get into the heart of our presentation, which is talking about perimenopause and menopause. And these are two distinct natural hormonal transitions in life. They typically occur between the ages of 40 and 55, but they can occur sooner. And in certain instances, they can occur very quickly, such as when there's certain organs removed that are hormone producing organs and things like that. So perimenopause typically comes first unless it's a more acute transition. So when perimenopause comes first, this can occur between 2 and 12 years before menopause. And during this time, estrogen levels typically rise and progesterone levels typically drop. So these are two female hormones, estrogen and progesterone. And women do feel best when these hormones are balanced with each other. So when they're kind of on par with each other. So in perimenopause, when estrogen levels are rising and progesterone levels are dropping, sometimes women can feel some symptoms from that because they'll feel symptoms of a hormone imbalance. So when one is high and one is low. Other hormones might be affected as well, and every individual is different when it comes to that. So perimenopause will eventually transition into menopause at age 51 on average. And by definition, menopause is 12 months after a woman's last period. So that means that if you get your period in January and then you get another one all the way in December at the end of the year, you'll have to restart the calendar. You're still in perimenopause. It's 12 months without a hormonal period. However, these definitions aren't as helpful as really individualizing what's going on and figuring out where a woman might be with her hormone levels. So in menopause, I'm talking about 12 months after a woman's last period, estrogen and progesterone levels are low. So in contrast to perimenopause, both female sex hormones are low, and other hormones such as testosterone and DHEA will often become low as well. And so this is a hormone graph showing what hormone levels look like throughout a woman's whole life. So estrogen is in red and progesterone is in blue. We can see that in childhood, estrogen and progesterone levels are low. And then as a woman approaches puberty, estrogen levels will rise a little bit. And then the ovaries will eventually catch up and start ovulating, which will result in progesterone production. So that's why estrogen is going to be a little bit ahead of the curve here. So throughout girl or young adults' teen years here, estrogen levels are going to continue to rise, and eventually progesterone levels are going to catch up. But what we can see here is that there is a little bit of hormonal imbalance going on because estrogen levels still are a little bit higher than progesterone. So here what we're seeing is estrogen levels are a little bit high, and that's one of the reasons why puberty can be a little bit difficult for some girls and young women. And that's because estrogen levels are rising, and because the ovaries haven't had a chance to catch up quite yet and be really regular with ovulation, sometimes we do get a little bit of unopposed estrogen, so an increase in estrogen levels. And this can result in things like irritability, menstrual cramping, breast tenderness, things like that. But oftentimes this gets better in time. And so once things level out and women get to their reproductive years, things get a little bit more consistent when it comes to hormonal output. So just in the middle of the graph here, what we're seeing is that estrogen levels are up and down with each menstrual cycle. That's totally normal. And progesterone levels are pretty steady as well. And so things will just kind of go like that throughout the reproductive years until we get to perimenopause, which we're going to be talking about today. So in perimenopause, the ovaries, because they're getting a little bit older, they're starting to think about what I always say, retiring. So they're not going to ovulate every month anymore. And when they don't ovulate every month anymore, we don't get progesterone produced every month anymore. So that's what's happening in perimenopause in that blue graph there, is that progesterone levels are dipping down a little bit. So we can see it's a little bit more erratic in the progesterone production. And it's at some periods, there's an extended period of time where there's no progesterone production. While at the same time, we can see in red, estrogen levels typically rise at the beginning of perimenopause. And that's when we can see some symptoms coming up for women. So some things that can happen during this time is increased menstrual bleeding, increased cramping, increased irritability, breast tenderness, things like that. And the reason that that's happening is because estrogen levels are rising and we don't have that progesterone opposition. So the hormones aren't balanced with each other. And we can see that as perimenopause kind of goes along here, estrogen levels are eventually going down a little bit, but progesterone levels don't ever catch up. So they're continuing to be low. And then eventually in menopause, what we see is both female hormones are low. So that's a little bit of a snapshot in what happens in a woman's lifetime when it comes to sex hormone production.
That's so neat to see it in a graph like that, Kayla, and to think that like during your women years, or not women years, your mother years, or I don't know, what years do you call those? Reproductive years.
Reproductive, yeah.
Okay, perfect. That, you know, when we're going through that cycle, that tiny little bit is such a big shift for some of us. It's like, I have PMS or I'm feeling this. But then in perimenopause, it's like so high. So it would just be so much more to deal with. Like to see it like that really, really puts it in perspective.
Yeah, I really like this graph as well. And what it can also illustrate is that any hormonal imbalances that are present in the reproductive years. So if some of these symptoms of perimenopause sound like symptoms that you experience throughout your reproductive years, sometimes, unfortunately, those symptoms can be worsened during perimenopause because everything will become augmented. Essentially, is what's happening in perimenopause. So yeah, I'm glad that helps put it in perspective.
Yeah, and it's kind of neat that you can see where you were as a child, and then in menopause that you're almost going back to what you were like as a child, but still a little bit a little bit out of whack, but going kind of back to what you were before you even hit puberty.
Exactly. Yeah.
Thanks for sharing that.
Yeah, you're welcome. And I wanted to give credit to Dr. Lara Bryden. She's an amazing ND who's put together a book called The Hormone Repair Manual, and that's where I got this image from.
Cool, thank you.
So let's talk a little bit about perimenopause. So you might be in perimenopause if you have at least 3 of these 9 signs. So new onset heavy and or longer flow, shorter menstrual cycles, often below 26 days, new sore, swollen, or lumpy breasts, new mid-sleep waking, increased menstrual cramps, onset of night sweats, in particular premenstrually, so before your period, new or markedly increased migraine headaches, new or increased premenstrual mood swings, weight gain without changes in exercise or eating. And here's another great visual from Dr. Bryden. So about perimenopause and really how it is a series of transitions, and it really can look differently for each woman. But in generally, what we're seeing is that in very early menopause, things are very similar to the regular reproductive years, except there's just a few small signs of change. So periods might shorten a little bit. A woman might notice that her flow is a little bit heavier, a little bit of breast tenderness. So just a few signs of change in very early menopause. And then in the menopause transition, eventually the person will notice irregular periods. So cycles might vary in length by 7 or more days initially. And then eventually it'll come to a time where there's a skipped period. So eventually there will be a time where it'll be 60 days without flow. And at that point in time, then a woman will know that she's in a later menopausal transition or later in their perimenopausal transition and heading towards that final menstruation. So that final menstruation before that 12-month period where there's no menses. And at that point, menopause is what's happening.
We have Tasha, who's watching right now, has a question.
Okay, I see it here. So does this include women with a hysterectomy that have ovaries still? So that's a great question. So in a woman with a hysterectomy, she's going to go, if she has her ovaries. So that's an important distinction. Sorry, I lost an AirPod here. So that's an important distinction. If a woman has her ovaries taken out, she will be launched into menopause right away. But if the ovaries are still there, it means that she is going to go through all of these perimenopausal and menopausal transitions. So all of the hormonal changes are going to occur, but we won't have the advantage of seeing the woman's menstrual periods as a guide. So that means that we would often need to do blood work or some other hormonal testing to really figure out where a woman is when it comes to perimenopause or menopause. And then menopause. So this is a period of life where there is low estrogen and progesterone. Women may experience some of these signs or symptoms. So night sweats, hot flashes, insomnia, mood changes, weight gain, especially around the midsection, vaginal dryness, thinning hair or dry skin, and low libido. So not everybody experiences all of these. These are just things that might help you understand the process, and we absolutely have treatments for all of them. So I want to chat a little bit more about hormone testing. So like I said, there are some times when hormone testing is very helpful. So as I was saying, it's really helpful to identify perimenopause or menopause in cases where a woman doesn't have a menstrual cycle for any reason, whether it's because of a hysterectomy, ablation, any other procedure that causes her not to have a menstrual cycle. So in that case, we will probably want to do hormone testing because we just are missing a key piece of the puzzle that really helps us understand what's going on. Hormone testing is also helpful during perimenopause due to the individual variability of hormone status and to understand the status of other hormones, in addition to estrogen and progesterone, that might be contributing to symptoms. So with perimenopause, because it's so individual, like the length of it is individual between 2 and 12 years. The symptoms are very individualized. It's really helpful to see in perimenopause what exactly is going on and what we can really start to treat if we go ahead with treatment. So definitely hormone testing is helpful in perimenopause. However, hormone testing might not be helpful in later menopausal years because we already know what hormones are doing at that time, as we know from the graph. So hormone levels are low in menopause, so oftentimes we actually don't need to treat in order to understand what's going on.
So I have just a question about hormone testing, if that's okay.
Mm-hmm.
I have heard from lots of my clients that their doctors will not test their hormones, especially if they aren't over 50 years old. So I'm curious because so many women have come to me as clients, their hearts pouring out about how they're feeling, and hormone testing seems to be something that would be a logical next step. But the medical system, as far as I can tell from my experience and experience through clients, is not willing to do that.
Mm-hmm. Yeah, so that's my experience as well, talking to people who have seen their medical doctors for hormone testing. Is oftentimes women are denied hormone testing, and there may be a few reasons for that. One of the main reasons for that is because medical doctors will often only test for something that they really have a treatment for. Right now, there's not many treatments for perimenopause. It's going to depend on which symptoms a woman is experiencing. So a medical doctor might recommend an IUD, for example, or an ablation, or even a hysterectomy. But if a woman is coming in, say, for insomnia, and she thinks that it might be her hormones, they're unlikely to test the hormones because they're more likely to recommend a sleeping pill, which has nothing to do with hormones, for example. So they're only really going to test as far as they know that they can use that information for a treatment.
It's really interesting to me because across the border in America, they do things very differently and they are apt to hormone testing. But here it seems so far in my experience that we are not. So when I found out that you did this, I was so excited to have you on here because women are really feeling, Kayla, like they don't have options. And the support that you offer in this is just, I mean, we're so lucky to have you here.
Oh, thank you. Yeah, this is a huge area of passion of mine. When I first started naturopathic medicine, I wanted to have a broad practice where I treated a variety of things. And I still treat pretty much almost anything. There are some things I don't treat, but I do have a general practice. But I ended up focusing in women's hormones just because there was that huge need for it. And because naturopathic medicine does fit into a unique niche to be able to help women feel better. And I saw it firsthand, people feeling better. And I was like, yeah, this is a place that I really want to focus on.
That is so cool. And I will never forget hearing you say, is it affecting the quality of your life? And that's at the point where you could really use support. And for me, especially dealing like in my own journey, but also with my clients, that statement to me just says, I care so much about your quality of life. And I just love you too. Did you see what Tasha said there?
Oh, thank you.
I love Dr. Kayla.
Yeah, that's a key question. What affects your quality of life? Because we want to start there. The main thing we want to do is help you feel better.
Absolutely.
So, hormone testing options. So, I want to say first, before you even talk about hormone testing options with any practitioner, whether it's a medical doctor or a naturopathic doctor, the first step is to start tracking your cycle. So, a good practitioner, and this is one key tip I can give you, if the doctor doesn't care when you're getting your hormones tested and what day of your cycle you're going to the lab, is probably a good sign that they don't really know what they're looking for. So a good practitioner will test hormones at a certain point in a woman's menstrual cycle. And I just kind of wanted to go back and touch on something else I was saying before and just say that I'm sure there are medical doctors out there that are doing this kind of work as well. Maybe we just haven't been exposed to them maybe as much as we want to. But definitely it's worthwhile to find a good practitioner.
Absolutely.
So there's a couple options to test hormones. So we can do regular lab work in a blood test. So options for this would be to test for estradiol, which is one type of estrogen, progesterone, and testosterone. We can also test other hormones as well, such as LH, FSH, but that's a little bit more in depth for today's purposes. But those are the main things that we can test for in regular lab work. There's also another option that has been a great option for many of my patients, and that's with Dutch testing. So this is called dried urine testing for comprehensive hormone analysis. And the advantage of this type of testing is that basically it's just a lot more comprehensive than your regular lab work. So it includes testing for estrogens, all three of them, so E1, E2, and E3, progesterone, testosterone, DHEA, and all their metabolites. So it shows us how a person is processing and breaking down their hormones. It also includes stress hormone testing, so cortisol and norepinephrine, and neurotransmitters such as dopamine and nutrient testing. So it gives us a really comprehensive look about what's going on. This is especially helpful in perimenopause because lots of other hormones can be affecting a woman's experience of perimenopause, such as testosterone that might be elevated or low, or cortisol that might be elevated or low, or stress hormones. So this allows us to really get a full picture about what's going on. And you can get more information about the Dutch test at dutchtest.com. So naturopathic support for perimenopause and menopause entails helping you navigate where you are at in this transition. So testing hormones when appropriate, helping manage any unpleasant symptoms that arise, helping identify and manage other health conditions if they're present, and maintaining health and preventing disease at all stages of life. My 3-step process for supporting individuals in perimenopause and menopause includes first, strengthening overall health, second, correcting hormonal imbalances if present, and 3, managing symptoms. So we'll get in depth into all of those steps. But first, I did just want to show you something that's really important to me, and it's the therapeutic order. So it's one of like our staples in naturopathic medicine to return to and make sure that we're doing our jobs correctly. So how this works is when we look at treatments that are available for a person, we always want to start at the bottom of the pyramid and then work our way up. So we want to start with the easiest, or sorry, not the easiest, the most gentle treatment options available, and then work towards the more intense treatments. So at the bottom of the pyramid, we have the establishment of the foundations for optimal health. So identify and remove obstacles to cure and assess the determinants of health. So this is like the basics. For example, making sure a person is sleeping, making sure that a person is eating well, that their stress levels aren't taking over, things like that. We want to make sure that we lay the proper groundwork before we go towards other treatments. Next, we can stimulate self-healing mechanisms. So that goes back to our naturopathic principles, where we really respect and acknowledge the healing power of nature and the ability of the body to heal. So we want to remove obstacles for this process to happen and allow it to happen by stimulating it. So that might be as easy as getting more sleep or doing more stress relieving activities. We're stimulating that parasympathetic nervous system to help have its own self-healing process. And then we want to identify, support, and restore weakened systems. So a really good example of this is, for example, in perimenopause, sometimes the liver is a little bit sluggish in removing excess estrogens. So for example, in this particular case, what we can do is help the liver just process those estrogens a little bit better, and that can sometimes help individuals feel better. So we want to really identify those areas that we want to support and then go and support them to support the health of the whole person. Next is addressing physical alignment. So this is something that I don't do a lot of in my particular practice. A lot of NDs do actually, but here in Kamloops, there's some really great massage therapists, chiropractors, physiotherapists that we can refer to address physical alignment. A lot of us can resonate with the fact that oftentimes stress and tension can manifest in physical tension in our body. And that's absolutely an aspect of health as well that we want to address in some cases. Next is natural symptom control. So this is using natural compounds like botanical medicines to help with symptoms. And this is something I do a lot of day in and day out, is recommending natural supplements. After we establish the foundations of health, then we can go and treat the symptoms. And next is synthetic symptom relief. So this would involve pharmaceutical prescriptions if necessary. And then at the very top, something that we actually don't really do at all would be high force interventions like surgery, like a hysterectomy. This is something that unfortunately I do see offered, like for example, a hysterectomy offered at the base of the pyramid, when really what we should do is start at the bottom and work our way up. And absolutely, if we need to go towards surgery to have symptom management, that might be necessary, but we should definitely start with the most gentle therapies first.
Oh, I love looking at that. And I love you just said that, because so, again, an abundance of women have said to me, well, that was my only choice.
Mm-hmm. Yeah, I think it's important that women know that there's other options available to them.
Thank you for sharing.
Mm-hmm. So support for perimenopause and menopause. So like I said, I have a 3-step protocol that I use as a guide. So the first thing would be to strengthen overall health. So we want to optimize nutrient status by optimizing a person's diet and also gastrointestinal health. So we know that gastrointestinal health is how we absorb our nutrients. So we want to make sure that's happening well and that we have the proper diet to optimize nutrient status. And we might need to use nutritional supplements when necessary as well. We want personalized exercise and stress management suggestions, especially if that's directly related to a person's goals. We want to identify and treat any obstacles to optimal health. So, a huge part of what I do is really determining whether there are other factors at play with a person's symptoms. Something doesn't happen in a bubble, it's always in relation to other things happening in the system. So we can definitely have perimenopause and a thyroid condition, or perimenopause and insulin resistance that's really contributing to the weight gain as well. So we need to actually take a thorough health history in order to identify and treat any other obstacles to optimal health. And also at the first visit, I always ask a really thorough family medical history as well so that we can identify risk factors and prevent future disease. The next step in the three-step process is to correct hormonal imbalances if present. So early on in perimenopause, what we want to do is support ovulation if possible. So ovulation is how we support progesterone production. That's how our body creates progesterone. Like I was saying, that's the female hormonal counterpart to estrogen. And lots of things need to be going right in a person's body in order for ovulation to occur. So, for example, if a person is overexercising and undereating, ovulation won't occur. If they don't have enough nutrients, ovulation won't occur. So we want to make sure that's happening for women, and then they do feel better with that. There's also certain botanical medicines that we can use to support ovulation. So I'm not going to make specific botanical medicine recommendations. It's always important to talk to your naturopathic doctor or other practitioner that's trained in that. But for example, Vitex is something that's really frequently used to support ovulation. And then we can use other botanical medicines that are specific for the hormonal transitions of perimenopause and menopause. So, for example, in perimenopause, we can help decrease the estrogen dominance that's created by helping to metabolize estrogen more efficiently through the liver and the gut. So, there's specific herbs and nutraceuticals that we can use to do that. And there's some really great combination formulas out there that I often recommend that kind of hit multiple areas, and we're able to get really good therapeutic outcomes from that. And some great botanicals for use in menopause include phytoestrogens. So phytoestrogens stimulate estrogen receptors. So basically, when there's a low hormonal situation, like in menopause, where there's low estrogen and low progesterone, the receptors are at the surface of the cell waiting for estrogen to come by, and it just doesn't. And that's one of the reasons why women get hormonal symptoms in menopause. So what phytoestrogens do is that they bind transiently to the estrogen receptor. So they don't have a full lock and key effect like normal estrogen does, but they do bind to the receptor a little bit. And this can really help with symptoms because it makes the body think that there's more estrogen than there really is. So that's my botanical medicines for menopause. And then in some cases, we do use bioidentical hormones when appropriate for these hormonal transitions. So this is a really important conversation to have with your naturopathic doctor or medical doctor if you think this is right for you, because there are risks and benefits to bioidentical hormones. But in some cases, they're a really, really good tool that we can use. And then the third step is to manage symptoms. So sometimes we establish the foundations of optimal health, we work towards hormone balance, and there's still other symptoms that we need to address, and that's totally okay because there's lots of treatment options available for them. So specific recommendations for sleep, hot flashes, low libido, weight management, heavier painful periods, and fatigue. All of those, they would take days for me to list off all the different treatments available for them, but that's very individualized for each person because oftentimes we can hit on multiple symptoms with kind of one product or one treatment, which is really nice. So this would include diet and lifestyle recommendations, botanical medicine, nutraceuticals, acupuncture, or in some cases, pharmaceutical prescribing as well. So I wanted to end off here with some wellness tips. So my first one is to explore new hobbies and interests. So I'm just acknowledging this is a transition in life, and it can be definitely difficult. So you want to make sure that you are doing something that makes you happy. So you might have to switch that up throughout your life and see what works for you. I often talk to my patients about self-care and how important that is and strengthening those habits. So we want to focus on restful, restorative, and health promoting activities. And I love the 3 R's, which are recover, rebalance, and revive. Establishing healthy boundaries are definitely key, as well as social supports, having those people to lean on. That's one of the reasons why I love that this group exists. I think that you have a great thing going here. And incorporate play. So that looks different for everybody. Dancing, music, sport, just something to let loose because we have so much energy to release. And if we can do that in a positive way, then that's great. One wellness tip that's really specific for perimenopause and menopause is try low impact exercises. It's not something you have to switch to completely, but that's something that's going to serve you throughout the rest of your life. If you have something that's low impact that you can do, even when as your body gets a little bit older, then these things become really accessible to you. So yoga, swimming, tai chi, etc. Even using the elliptical instead of running can be really easy on the joints. And my fourth wellness tip is to consider having a naturopathic doctor on your healthcare team. There's lots of great ones in Kamloops. I'm accepting new patients right now, and I offer free 15-minute introductory consultations. So you get a chance to talk to me, make sure that we're a right fit, and just go from there. So here's my contact information. So that's where you can reach me. I'm at the Movement Mechanics in Sahali. Feel free to reach out to me on email if you have any questions about my presentation at all. You can check out my website. And then there's also the booking link as well if you wanted to book an introductory visit.
And we'll take that too, Kayla, and I'll move this chat and put it into the guide section, and then I'll put your link on it too so that anyone who watches the replay can just click on your links on there too. So if anyone doesn't get it off of here.
Awesome, thank you.
Yeah, but back up one slide here for a minute.
Mm-hmm.
So I love this because these wellness tips, like to keep our brains going and trying new things and new interests is so important. And these things that you're laying out here are, we know that this is what we need to do. But as women, we're like, I don't have time. I'm taking care of everyone else. I don't even know what I like anymore because I've spent my life taking care of everyone else. And so there are things that I think are that we know we should do, but for a lot of people, they're really hard to do. And same with even having a naturopathic doctor. Sometimes it's out of people's budget, or they don't even know what they like, all of the stuff that you just laid out here, how much they can actually have help from a naturopathic doctor. Mm-hmm. So I love that you put this whole wellness tips thing together, because so much of this is what I teach in my teachings about menopause, about play and rest. And basically life is about rest and play, balancing those things and trying new things and making sure you have people on your team. And there's so, like we said, women in menopause are like snowflakes. No two journey is the same. They're all unique. And to have naturopathic doctors, and like you said earlier, maybe massage therapists or chiropractors or sleep therapists or therapists, counselors, all different kinds of things. There's so many different things that we need to have on our team. And I really think that anyone would be so lucky to have you on their team.
Well, thank you.
Yeah, you're
welcome. It'd be great to connect with more people who are looking for that sort of support, or even if you wanted a recommendation for someone in Kamloops, whether it's a massage therapist or something like that, feel free to reach out to whether it's this community or to myself. I think we're happy to help connect people to people that can help you feel better.
Yeah, exactly. I love that. I really appreciate you sharing all of this with us today. Is there anything else you want to add from your presentation?
I just wanted to thank you for having me. This has been really, really great. And yeah, I wish you all the best in your journeys wherever you're at.
Thank you so much. And thanks for sharing it with everyone in this group. I'm excited to see who watches the replays, and I know that there will be people reaching out to you.
Awesome. Well,
Okay,
thank
so
you
we'll
for
say bye to
having
the
me.
group, and then me and you will still be in here.
Okay,
Bye.
sounds good. Bye, everybody.